Joining us now, we're honored to have with us another award winner at the 2012 ASCO conference, and he is Timothy Vreeland, MD, from the San Antonio Military Medical Center. Thanks for being here.
Of course, sure.
At ease, soldier, okay? I've always wanted to say that. So tell me about being granted this 2012 Merit Award here. That's quite an honor.
Right, yeah, it's a great honor. Even as a resident, it's an honor just to be able to present here at a big meeting like this, and to win an award additionally is a great honor. I think it reflects the work of our group more than anything. The research that Dr. People started 10 years ago or so is really taking off recently, and I've been lucky enough to kind of jump on his coattails and be able to win an award for that is great. So
you're a general surgery resident and a research fellow, and you wind up at the world's biggest oncology conference as a presenter. What's this experience like for you?
It's great. A little nerve-wracking at times, but it's, as I said, it's a great honor, and to be able to have this kind of exposure as a third-year resident is really pretty remarkable, so it's been great. So
the AE37 trial, it's a hybrid vaccine. Can you just give me a background on that, and then we'll get into what you did with it?
Sure. So the technology, the hybrid technology, is a pretty exciting technology because it offers the ability to go at CD4 T cells, which is an area that especially peptide vaccines have failed to do in the past. And so this technology offers that ability to go after the CD4 T cells, which is a key target in eliciting a strong immune response, and especially immune memory, which is part of what makes a vaccine so appealing, is that the immune memory can give some efficacy to a vaccine long term. So this hybrid vaccine, we found some signal of success early in the trial. So it's an exciting time to be a part of the trial, and I think it'll move forward for sure.
Now, what was your role? What's the work you did on the AE37 trial?
Right, so as a research fellow under Dr. Peoples and Dr. Mittendorf, I do a lot of the behind-the-scenes work, sort of crunching the numbers, doing statistics, putting together abstracts for meetings like this, putting together papers, things like that.
What's most compelling in the data that you've analyzed?
The data that we're presenting here today is it's an early interim analysis. So our median follow-up is 22 months. So it's pretty early in an adjuvant trial. Usually don't see a signal until 2 or 3 years into a trial like this. So the fact that we're only at about 2 years and we're already seeing a signal towards decreased recurrence in the vaccine arm is very promising.
Now, where will you go back to work on this? Your role will be...
Right, so after the meeting I return to San Antonio, and I'll be there for 3 more years as a general surgery resident. So I'll finish my research fellowship in about a month or so, and I'll return to my regular work as a general surgery resident, but certainly I'll remain involved in the lab and with Dr. Peoples and Dr. Mittendorf.
How has the process been like, working not only with military medical professionals, but also getting involved with professionals from the MD Anderson Cancer Center?
Right, it's great. It's the ability to be linked in with MD Anderson is great. Our military hospital is it's a very large military hospital, and we have most of the things that you would find at any civilian hospital. So it's not that it's incredibly different day to day at our hospital versus a civilian hospital, but anytime you can be linked in with MD Anderson, which is such a huge name in cancer research, it's been a great opportunity.
Very good. Congratulations on your success, and thank you for your service to the country.
Appreciate you having me.
Okay. Dr. Timothy Vreeland from the San Antonio Military Medical Center joining us here at ASCO 2012.